Hi, thank you so much for coming in to visit with us today.
No problem.
So tell me a little bit about how you discovered you had fibroids.
It actually first started just with symptoms of heart palpitations and shortness of breath while I'm in healthcare. I work in the hospital, so I didn't really pay much attention to it until it got to the point where I couldn't ignore it anymore. So I went to my general practitioner. You know, they took the blood level test and they were like, oh, you have a very low hemoglobin level. So eventually, obviously, they diagnosed me with anemia. I had to go to the hospital to get 3 units of blood, and then that's when they, of course, did all those tests. And they did an ultrasound, and they found some abnormalities in my ultrasound, so they eventually referred me to go see my gynecologist.
And so what happened then?
So I went to my gynecologist, and the ultrasound was kind of blurry, so she was like, let's get an MRI. And on the MRI, she found, for her, the most concerning was 2 big cysts on my ovaries. And at that time, she thought they were fibroids, but wasn't really sure. But because there were cysts on my ovaries, she referred me to a gynecologic oncologist just to make sure that they weren't cancerous. When I went to see the gyn-onc, he basically said, yes, you have cysts on your ovaries and you have fibroids. And he gave me what his treatment would be to have a hysterectomy, just kind of take care of things all at once, the fibroid, and this is on the ovaries. For me, at the time emotionally, I was like, okay, that's a treatment because, you just kind of want to get it over with. But I have a friend who's an interventional radiologist, and she's like, maybe you should get a second opinion. And eventually I agreed with her because the idea of having a hysterectomy, having an organ taken out of me, that's a big part of your body where it would be an open cavity where something used to be. Emotionally, it defines me as a woman. And of course, I would be at menopause, so I would have to go on hormone treatment. And there's a lot of things that eventually, when I thought things through, that there had to be another procedure, another way to deal with it. And so my friend who's an interventional radiologist introduced me, she's like, there's something called a UFE that could be a possible second option for you. And so I was really lucky. My gyn-onc works very closely with Dr. Slonim, who works for the Fibroid Institute. And between the two of them, they coordinated a plan of care for me in terms of dealing with both the cysts on my ovaries and the fibroids that they found.
Oh, that's wonderful.
Yeah.
So tell me a little bit about your UFE experience.
My UFE experience actually was really seamless. Something that I really appreciated about my consultation with Dr. Slonim was she brought up my MRI. She showed me another MRI that would what a normal uterus would look like, and she actually pinpointed, what was wrong. And she was very compassionate about my plan of care. She didn't pressure me in one way or another, and she's like, this is just another option for you to consider.
And she was going over the MRI with you. Was this in person or was this over the
Oh, it was over Zoom.
Over Zoom?
So
Okay.
it was over Zoom.
Wonderful.
I had the option of coming in person or over Zoom, but I did it over Zoom. And even then, you could feel the genuine care that she wanted to provide, and not just convince me to do a UFE, but the genuine care as a doctor who wants the best interest for her patient.
Right.
So whether or not I would go with the hysterectomy or the UFE, it was depending on how I felt about it, and also just presenting the option of a UFE and what that would entail. So going back to your question about the procedure, before the procedure, they had everything set up for me in terms of insurance approval. They were very proactive about getting appointment times in, and even the medication that I would have to take post-op, it was all prepared for me. So after the procedure, because it was just a day procedure, I just went home with a baggie full of medication, and that was it. And for me personally, that was really nice because I'm single, and I do work a lot, and so just having a seamless procedure from beginning to end, to not have to worry about going to a pharmacy or anything, it made my life a lot easier. And also, Dr. Slonim gave me her personal cell phone number. I think she gives that to all her patients, and it's kind of comfort in the back of your mind that if anything goes wrong, that you can just text her and she'd be there for you on call. And yeah, so I'm very happy that I got the UFE. Yeah.
How was your recovery? Because you had everything you needed.
My recovery was really seamless. So what I didn't mention was I did actually have to get 2 surgeries. One was to get the cysts off my ovaries that they saw, and I did that with my oncologist.
Okay.
And then I had my UFE. And I guess the reason why I wanted to bring those up because I was in a position where I could compare what my recoveries were from a surgery and a procedure. And I'm a workaholic, so for my first surgery to get the cysts for my ovaries, I felt good after like the first or 2 days, and so like I went back to work, but that was not the best idea because after a couple of weeks I started to feel the fatigue. So when I had the UFE, Dr. Sloan was like, okay, here's the schedule of the medication. She printed it all out. She was like, follow this schedule. You need to have the proper rest. And I felt, after the surgery, the procedure, I felt fine. Like 2 to 3 days, I was like, okay, I'm ready to go. But in the back of my mind, I was like, Dr. Sloan told me I need to like properly recover. So I was a good patient. And so after a week, I was like, okay, I'm ready to go. And I didn't feel any fatigue after that. It was just, and it was great. I can also compare with my surgery, I had 3 incisions on my stomach. And so there was some scar and wound management that had to be done. But with my UFE, it was just a little dot, like you can't even see it anymore.
What would you say to a friend or a family member who was in the same situation?
If I had a friend or family member who was in the same situation, I would really encourage them to go for a second opinion for UFE. I was lucky because I have a friend who's an interventional radiologist, so I knew about it. But I also know that this procedure isn't very well known. I think society understands what a hysterectomy is, and they've heard it. But not a lot of people know what a UFE is. Not a lot of people even know that there's some interventional radiologist. It's a very specialized field. But I feel like it's something I think the public should know about because it's a less invasive surgery. The recovery period is it's seamless, and I feel like as women we should have more options of what we can do with our body besides just having hysterectomy and let that be the end all be all. I think it's nice to have options now where it isn't a big surgery and it's just procedure and you go home, and with the Fibroid Institute it's everything was just kind of all wrapped up in a big package with a bow, and it was just a very easy recovery for me. And as a single woman, and I live alone in my house, it was nice that I didn't have to worry about all the things that you have to take care of post-op. Right. So yeah, I would really recommend it. And especially with Dr. Sloan, they're not going to push you one way or the other. They're going to give you the best plan of care that they think is in your best interest. And so that's why I think just being open to having UFE is, to keep your mind open to that.
Right.
Yeah.
So what can you do now that you couldn't do before?
I guess before, actually, because of the fibroid, it really affected my menstrual cycle. So my menstrual cycle used to be really heavy, and they would obviously not just disturb my activities of daily living, just work and stuff, but it would also affect my sleep patterns because I'd have to get up often because the cycle was so heavy. But now everything is back to normal. I have no, residual symptoms from the UFE or, my menstrual cycle is, normal now, and
That's
it's
great.
not affecting the way I live my life. And sometimes I forget I've even had the UFE because it's just, everything is back to where it was. Yeah.
That's amazing. Wow. Well, thank you.
You're welcome.